Hello, I'm Dr. Nad. What brings you in today?
Hi, Dr. Nad. I've been experiencing irregular periods, some stubborn acne, and a bit of extra hair growth on my chin. I'm also finding it harder to control my weight, even though I eat pretty well and exercise. A friend mentioned it could be Polycystic Ovary Syndrome or PCOS. Can we talk about that?
Absolutely. PCOS is one of the most common hormonal conditions affecting women of reproductive age, and you're definitely not alone in having questions about it. Let's take some time to discuss what PCOS is, how it's diagnosed, the symptoms, and, importantly, how to manage it, especially with diet and exercise strategies.
I've heard of PCOS, but what exactly is it?
Great question. Polycystic Ovary Syndrome, or PCOS, is a chronic hormonal disorder and endocrine metabolic condition that affects around 6% to 13% of women of reproductive age globally. Some recent studies even estimate it may affect up to 1 in 5 women, depending on how it's diagnosed and which countries or communities you look at. PCOS is characterized mainly by 3 things: irregular or absent periods due to disrupted ovulation, high levels of androgens, or male hormones in the body, which can cause acne and excess hair growth, called hirsutism. Polycystic ovaries, meaning your ovaries may have many small follicles, visible on ultrasound, or produce higher amounts of certain hormones. But despite the name, you don't always have to have cysts on your ovaries to be diagnosed with PCOS, and these cysts are not dangerous or cancerous. In fact, the term polycystic is a bit misleading. The small follicles are eggs that haven't matured, not typical fluid-filled cysts.
Wow, that sounds complicated. So, do we know why it happens?
We're still learning, but PCOS likely results from a complex interplay of genetic factors, so it can run in families, alongside environmental and lifestyle factors. Insulin resistance, hormonal imbalances, inflammation, and even sleep patterns and stress can all play roles. Diagnosis often takes time. Many women, like yourself, don't notice the symptoms right away, or may think their symptoms are normal teen issues or simply due to stress or lifestyle. It's not uncommon for diagnosis to take months or even years after symptoms first appear, which can understandably be frustrating. What's especially important is that PCOS is not just a reproductive issue. Long-term, it's linked to increased risks for type 2 diabetes, high blood pressure, high cholesterol, heart disease, and challenges like anxiety, depression, and sleep disorders.
What's actually happening in my body with PCOS?
At its core, PCOS involves an imbalance in hormones. Here's what we know from recent evidence. High levels of androgens like testosterone are central. These are male-type hormones that women naturally have in smaller amounts. In PCOS, the ovaries and sometimes the adrenal glands produce too much. Insulin resistance is very common, even in women who are not overweight. About 75% to 95% of people with PCOS have cells that don't respond well to insulin, a hormone that helps regulate blood sugar. This causes the body to produce more insulin, which worsens the hormonal imbalance and drives up androgen production. Ovulation problems result from these hormonal changes. The higher androgens interfere with the normal development and release of eggs each month, leading to irregular or absent periods. Additionally, there's a growing understanding that inflammation, disruption in gut health, and even disturbed sleep patterns may all play contributing roles in PCOS severity and symptoms.
I've had irregular periods, acne, and extra hair growth. Could these all be PCOS symptoms?
Absolutely. PCOS has a wide variety of symptoms, and not all women will experience every symptom. The most common include irregular menstrual cycles. Cycles may be longer than 35 days, unpredictable, or even absent for months. Signs of excess androgens. These can include acne, oily skin, hirsutism, excess hair growth on the face, chest, or abdomen, and sometimes thinning hair on the scalp. Difficulty with weight management. Many women with PCOS gain weight more easily, particularly around the abdomen. Fertility issues. Trouble conceiving due to irregular ovulation is a frequent concern. Nude concerns. Increased rates of depression, anxiety, and poor body image are much more common. Other possible symptoms: skin tags, darkened skin patches, acanthosis nigricans, and sleep disturbances. The diagnostic gold standard for PCOS is the Rotterdam criteria. You need to meet 2 of these 3 features. After ruling out other causes, ovulatory dysfunction, irregular or absent periods. Clinical or biochemical hyperandrogenism, signs or lab evidence of excess androgens. Polycystic ovarian appearance on ultrasound, or elevated anti-Mullerian hormone AMH. Your healthcare provider will also take a detailed history, do a physical exam, and may order hormone blood tests and/or an ultrasound. Importantly, we also need to check for related conditions like diabetes, thyroid issues, and sleep apnea.
Once someone is diagnosed with PCOS, what's the first step in treatment?
Current international guidelines, released most recently in 2023 after contributions from multiple global medical societies, emphasize lifestyle management as the first-line approach for almost everyone with PCOS, regardless of body weight or other risk factors. Medical treatments like hormone therapy, birth control pills, anti-androgens, metformin, and fertility medications are essential tools as well. But lifestyle interventions, healthy eating, regular movement, stress reduction, and sleep hygiene have huge impacts on both symptoms and long-term risks. There is increasing recognition that a whole-person, tailored approach based on each patient's goals and values leads to the best outcomes.
So, what does lifestyle modification mean for someone with PCOS?
At its core, lifestyle modification means adopting healthy habits that support your hormonal, metabolic, and psychological health. According to recent reviews, these should be your foundation. Dietary adjustments, emphasizing strategies we'll discuss in detail next. Regular exercise, with a focus on finding enjoyable movement. Sleep quality, since sleep disturbances are more common in PCOS. Stress management, as chronic stress can worsen hormonal imbalance. Behavioral support, like counseling or group support, which can help with motivation and consistency. Even modest changes in these areas, especially if sustained, can lead to significant improvements in menstrual regularity, weight management, emotional well-being, and longer-term risks like diabetes or high blood pressure.
There's so much conflicting advice online. Is there a best diet for PCOS?
It's true. There's lots of hype, but solid science points to a few core principles. While there isn't a single PCOS diet, several patterns have shown notable benefits. Mediterranean diet, rich in vegetables, fruits, whole grains, nuts, legumes, extra virgin olive oil, and regular fish intake. Studies show it lowers inflammation, improves insulin sensitivity, supports hormone balance, and is relatively easy to stick with long-term. Low glycemic index diet prioritizes foods that don't spike blood sugar, such as whole grains, legumes, non-starchy vegetables, and some fruits, helps regulate blood sugar and improve insulin sensitivity, a central concern in PCOS. Higher protein diets, within moderation, including sources like eggs, fish, poultry, beans, Greek yogurt, and tofu, which can enhance fullness and blood sugar control. Anti-inflammatory foods, fatty fish like salmon, flax seeds, walnuts, berries, and leafy greens all help reduce inflammation prevalent in PCOS.
But what should a typical meal look like?
Let's break it down for a real-world meal. Half your plate, colorful non-starchy vegetables like spinach, broccoli, peppers. 1/4, lean protein, such as grilled fish, chicken, eggs, beans. 1/4, complex carbohydrates with a low glycemic index, like brown rice, quinoa, lentils. Healthy fats, a drizzle of olive oil, a handful of nuts, or some avocado. Limit sugary drinks, ultra-processed snacks, and excess saturated fats. Example, PCOS-friendly dinner plate. Let's build your plate the PCOS-friendly way. Fill half with non-starchy veggies like broccoli, peppers, or leafy greens, 1/4 with lean protein such as salmon, eggs, tofu, or beans, and the other 1/4 with complex carbs like quinoa, sweet potato, or brown rice. Then, add a touch of healthy fat, olive oil, walnuts, flaxseed, and, if you like, some fruits such as berries or apple slices. Simple, balanced, and colorful. A PCOS-friendly plate should be visually diverse, filling, and relatively easy to prepare. The focus is on whole foods, fiber, and balancing macronutrients, all of which help manage insulin levels and overall hormones.
Are there specific vitamins or supplements that help with PCOS?
Some nutrients do seem especially important for women with PCOS. Here's what the research says. Vitamin D deficiency is common and may worsen insulin resistance. Getting enough from sun exposure, fortified foods, and possibly supplements can help, but levels should be checked and discussed with your provider. Omega-3 fatty acids. These anti-inflammatory fats, found in fish, walnuts, flaxseed, and chia, may help with insulin resistance, cholesterol, and inflammation. Some studies support using fish oil supplements.
What kind of exercise is best? I get conflicting advice about intensity and type.
The best exercise for PCOS is one you can stick with. Here's what current evidence-based guidelines recommend. Aerobic, cardio exercise. Activities like brisk walking, cycling, dancing, running, or swimming at moderate to vigorous intensity. Aim for at least 150 minutes per week. Regular aerobic exercise improves insulin sensitivity, supports weight management, helps regulate periods, and reduces androgens. Strength resistance training. Using your own body weight, resistance bands, free weights, or machines twice per week. Studies show that resistance training improves insulin sensitivity, builds muscle, reduces abdominal fat, and can lower androgen levels. Combined training. The best results for metabolic and hormonal outcomes are seen when cardio and strength work are mixed together each week. Flexibility, stress-reducing activities. Yoga and Pilates can help with stress, mood, and possibly insulin resistance. They also improve flexibility and strength.
If I'm not already active, where should I start?
Start small and build gradually. Even 10 minutes most days is better than nothing. Here's a simple starting week. Monday, Thursday, 30 minutes brisk walking. Tuesday, Saturday, 15 to 20 minutes strength training, using body weight or light weights, focusing on major muscles. Wednesday, Sunday, yoga, stretching, or restorative movement for 20 minutes. Friday, rest, light walk, or fun dance activity. Over time, you can increase intensity, add more strength work, or try different cardio activities, cycling, swimming, fitness classes. The key is consistency and enjoyment.
How fast will I see results?
Many people experience benefits within weeks to a few months, like more regular cycles, better mood, easier weight management, and clearer skin. Research shows that just 5 to 10% weight loss for those who are overweight can help regulate periods and reduce symptoms. But even without weight loss, regular movement improves insulin sensitivity, reduces cardiovascular risk, and lowers androgens, all of which are essential for PCOS health.
Making changes is tough. Any advice for sticking to new habits?
Absolutely. And it's normal to find change challenging. A few proven strategies. Set small, achievable goals. For example, I will walk for 15 minutes 3 times this week, rather than I'll exercise an hour every day. Track your progress with a journal or an app. Monitor your symptoms, moods, and cycles. Seeing improvement is motivating. Find a buddy or support group. Social support increases accountability and confidence. PCOS-specific support groups in person or online can be especially helpful. Focus on non-scale victories. More energy, better sleep, and improved mood are all valuable. Work with professionals such as a registered dietitian, an exercise coach, or a mental health counselor familiar with PCOS for more personalized support. Also, don't overlook sleep and stress management. Poor sleep is common in PCOS, and improving sleep quality and reducing stress can significantly influence insulin, hunger hormones, and mood.
Is PCOS only a concern if I want to get pregnant? And will it ever go away?
Those are common misunderstandings. PCOS is a lifelong condition, but symptoms can change over time, especially with good self-care. Although it's a leading cause of infertility due to irregular ovulation, it affects more than just fertility. PCOS raises the risk of future diabetes, high cholesterol, heart disease, and even uterine cancer, so ongoing management is crucial at every life stage. It doesn't necessarily go away, but many women find their symptoms improve when they adopt healthier habits, even if fertility is not their main concern. Also, thin women and those who don't want children still need support and regular screening for associated risks.
Is there a cure?
PCOS isn't curable, but most symptoms are manageable. With a tailored approach, addressing diet, exercise, sleep, stress, and, when appropriate, medications or supplements, many women achieve regular cycles, see improvements in skin and hair, manage weight more easily, and protect long-term health.
Thank you for explaining everything. Could you help me summarize what I should focus on for managing my PCOS?
Of course. Here's a personalized practical action plan. Nutrition. Prioritize the Mediterranean or low glycemic diet with whole foods, fiber, healthy fats, and lean proteins. Limit added sugars, ultra-processed foods, and sugary drinks. Vitamin D, omega-3 movement. Aim for at least 150 minutes of moderate exercise weekly, combining cardio and resistance training. Remember, short and consistent is better than intense and unsustainable. Weight management. If recommended and desired, aim for moderate weight loss if you are overweight. Sleep and stress. Sleep and stress. Target 7 to 9 hours of quality sleep per night. Explore stress reduction methods, mindfulness, gentle movement, and talking with supportive people. Regular monitoring. Track your periods, symptoms, mood, and metabolic health with your healthcare team. Screen regularly for diabetes, cholesterol, and emotional well-being.
That's so helpful, Dr. Nad. I feel less overwhelmed and more hopeful now. I appreciate you breaking it all down and not rushing to just put me on medication.
You're very welcome. Remember, managing PCOS is a marathon, not a sprint. It's about steady, sustainable steps that fit your values, goals, and lifestyle. Whether for symptom relief, fertility, or long-term health, you have effective options. Never hesitate to ask for support or additional advice. Together, we can find what works best for you. If you or someone you know is experiencing symptoms like irregular periods, excess hair, or unexplained weight changes, talk to a healthcare provider. With the right information and support, PCOS can be well managed.
Take good care of yourselves, and don't forget to like, comment, and subscribe.